Welcome back to Therapy Thursdays. Today we're going to show you some exercises for the neck, specifically exercises to target the deep neck flexors. The deep neck flexors have been talked about and discussed as the core muscles of the neck. In the last 15 or 20 years, there's been a lot of research in the motor vehicle accident world that have identified that these muscles are specifically problematic after an accident or after a neck pain episode. So it's really important that you rehabilitate these muscles fully to get a full recovery from your injury. It's also really important for the office worker. We often see office workers get more and more over the years into this protruded head forward position. So the deep neck flexors will help align the neck into more of a chin tuck, straightened up position, and that's going to help improve your postural awareness and postural control. Some of these exercises we were given that I'm going to show you are quite advanced. These exercises came up in a course with Matt Nickel a couple of weeks ago in a continuing education. So give these a try, but be careful, some of them are quite difficult. So the first is your basic chin tuck in a sitting position. Before you start, get in a good posture, shoulders down and back. And what you want to do is tuck the chin in, create yourself a double chin, and relax. Retract the neck, sit up nice and tall, hold for 3 seconds, and relax. You want to make sure that you are not approximating your chin towards your sternum. So straight back, hold, and relax. So the second exercise is just a simple modification. We're using the med ball as a little bit of resistance or pressure to the chin tuck. So I'm standing up, pressing the ball against the wall, and retracting my neck, holding for a couple seconds, and relax. Just using the ball as resistance. So now we're progressing a little bit more advanced. We're going to use a chin tuck isometric hold and then do some very isolated nodding exercises. So it looks like this. Forehead, put some pressure against the ball, get into a chin tuck and hold this before you do anything, and then a small nod, creating a little bit of movement of this med ball on the wall. So this is just a variation of the previous progression. I'm on a 45-degree angle to the wall. The pressure is off the side of my forehead. Get into a chin tuck position and then nod straight forward. You should feel on this variation that the activation is purely isolated or more concentrated on the side facing the ball. So lastly, we have a strength progression, which is a supine bridge on the ball. So you can make this quite difficult depending on how far you shift your body weight away from the ball to have the neck supporting it. So to start, nice chin tuck position right off the get-go. Slowly walk yourself away. Get a nice bridge position and walk as far away as you can to a difficult challenge and slowly back off. Hold, and shift the ball underneath the shoulder blades. So we've just shown you some deep neck flexor progressions. Give these a try, but I would caution you to check with your healthcare provider to make sure they're appropriate for your specific condition. As part of an overall strengthening routine, these can be a great prophylactic exercise to help with posture control and protective support for your neck in participation for sport and also just in your daily work environment.